Are you ready to explore exciting careers in neuroscience and neurotechnologies? Then join me, your podcast host, Dr. Milena Krastenskaya, or simply Dr. K, and my amazing guests on the Neurocareers Doing the Impossible podcast. Discover what it takes to turn the impossible into reality. Tune in now to a thrilling episode number 46. Dear listeners, welcome back to Neurocareers Doing the Impossible, the podcast that brings you the latest in neuroscience and neurotechnologies straight from the experts. I'm honored to introduce today's guest, Dr. Gerwin Schalk, whom I first met at the fourth BCI meeting in Asilomar, California in 2010. I still remember how Dr. Schalk waved at me and invited me to step outside while I was listening to one of the lectures. He then showed me a video on his phone that left a lasting impact on my career. In just a few seconds, Dr. Schalk demonstrated a real-time functional mapping of the brain for individuals undergoing evaluation for epilepsy surgery. It was a breakthrough that he and his team had developed and that is now used by institutions worldwide to help patients avoid surgical morbidity after surgery. Dr. Schalk is a co-founder and chief scientific officer at Helios Life Enterprises, where he leads the scientific and technical development of Comprehend, an AI-based system that can extract important information about firms from the tone of an executive voice during earnings conference calls. He is also the director at Frontier Lab for Applied Neurotechnology, Changchou and Chrissy Chen Institute, where he is working to improve people's life by developing and promoting novel and useful neurotechnologies. In this episode, we will delve into Dr. Schalk's groundbreaking neuroscience, neuroengineering work, where he performed research with neurological patients, decoding language and other aspects of human function from brain signals. He will share insights into his vast experience and knowledge in medical device technology and his invention of a new functional mapping procedure for neurosurgery that was licensed to a corporate partner. And of course, he will offer tips and advice for students and professionals looking to build careers in neuroscience and related fields. So, sit back, relax, and get ready to be inspired by Dr. Gerwin Schalk's insights and experiences in the world of neuroscience and neurotechnologies.
Today, I'm joining from Shanghai in China. Shanghai is one of the biggest cities in China, has about, I think, 27 million people now. So it's about 3 times as big or as large as New York City. It's really a very interesting mix of old traditional Chinese culture and very, very modern metropolitan city like New York and Tokyo and other big cities like that. So it's a very exciting place, extremely dynamic, even more, I think China in general and Shanghai specifically, extremely dynamic. There's people are building left and right. There's construction projects. There's new businesses. So it's even more dynamic than a place like New York, even faster, I think. Very exciting place. And very happy to be here in Shanghai and very happy to be on the podcast today.
Yeah, thank you so much, Dr. Schalk. And can you briefly introduce yourself and tell our listeners what brought you to Shanghai? So it's not Austria where you were born, not Albany, New York, where you worked for a number of years, but Shanghai. How did it happen and what do you do there?
Yeah, I was born in Austria, received a education, mostly engineering. So I have a master's degree in electrical engineering and computer science. Then moved to the US, spent 20 years in the US in research in neuroscience and neuroengineering research. On the way, got a second master's in IT with an e-business focus. and then a PhD in computer and systems engineering from Rensselaer Polytechnic Institute in Troy, New York. And so really then spent 20 years in academia, essentially teaching myself neuroscience, teaching myself clinical applications, and then got a huge opportunity to come here to Shanghai to now lead a laboratory. It's called the Tianqiao and Chrissy Chen Institute Frontier Lab in Applied Neurotechnology, to really take all this understanding that I've achieved and learned over the past 20 years and wrap it into the development of new devices that are helping people with neurological disorders. So think of things like a sleep monitoring device that can allow people to understand their sleep better at home without having to go to a sleep laboratory and things like that. So China is really in many ways an interesting place, both for me personally, as you pointed out, Milena, born in Austria, spent the first half of my life in Austria, then the next part of my life in the US. Obviously, it's a great place and many things to learn, but China is much bigger, and China actually has very interesting characteristics in the medical domain that are very different from both Europe and the US. For example, most of the healthcare is self-pay. So that means the patients care a lot about how much a therapy is. In the United States, many or most people have health insurance, so the health insurance will pay. And then they just go to a hospital and they don't care in a way how expensive the treatment is because the insurance pays. Well, in China, it's not like that. So first of all, they don't have enough physicians. So there's, for example, only one physician, one psychiatrist for every 10,000 people, for example. So there's a very strong need for help for people that can't get help from a physician because they don't have access to one. And even if they did, they probably couldn't afford it. So if there's some new way to learn about your own brain, basically, and learn about it better and optimize it and improve it, then that would be terrific. So that's some of the factors that make China an interesting place for those kind of innovations in this space. And that's a big reason why I'm here, in addition to the great city and the opportunity in general to build this kind of laboratory.
Yeah, thank you so much for mentioning this and emphasizing this unique landscape that China has, which is very supportive for the development of neurotechnologies that can simplify the therapeutic use and to help so many people. Before we go into the detail, because I would like to learn more, of course, about that, I would like to start with your childhood and go into your past in your memory lane and see what was going on when you were growing up. Can you recall maybe any interest that is related to what you are doing now, or it was absolutely unrelated? How did you get even into the field of engineering and started working with the technology? So how did it all develop?
It actually started very early. I got my first computer when I was, I think, 12 years old. It was a Commodore VC20. It had 3,583 bytes of RAM, not kilobytes, megabytes, or gigabytes, bytes of RAM. So you could write little computer programs in BASIC. So you could write something and you would play maybe a Christmas song or something. So that's how I got into it. Started teaching myself programming at age 12. So by the time I was 15, we started to have informatics in school, in high school. At that time, I was already basically a much better programmer than any of our informatics teachers. And by the time I was 18, of course, I was going to go to university and study electrical engineering, computer science, of course, just to continue this kind of engineering. I was really, really curious. And I think this is probably one of the most important characteristics for anybody is curiosity, is to want to learn more about things. And so this was, of course, at a time when computers weren't as prevalent as before. Now, of course, more and more students started having computers, but they weren't as integral to our lives as they are now. So I taught myself a lot about computers, basically spent a lot of time teaching myself different programming languages, and of course then had all the formal education of an engineer. But that was really the growing up, very strong interest in engineering and actually learning something so that I could build new things that didn't exist before. And that's, of course, then what I started using later as I started working and getting into this sort of unique combination with neuroscience. But really starting out as an engineer, getting my first master's degree in engineering in Austria.
Yes, I think what you just said is very much in line with what Andreas Forsland was speaking about in one of our podcasts. He is a CEO of Cognition. He also noted from the very beginning, from the early years, this curiosity about how do the things work. Yes, so always questioning how does it all work, and also learning, because he says even you didn't accomplish anything that you planned for the day, but you learned something, that's already a big achievement. So learning always, learning constantly.
And I think this ability to learn was always particularly important in this neuroscience, neuroengineering, clinical domain that we're kind of talking about, right? There's no engineer, or very few engineers actually also have a medical degree, for example. So if you just know engineering, then you don't know anything about medical domain typically, right?
Mm-hmm.
But if you want to succeed, and we can talk about that more later, understanding the medical domain or a business domain or the neuroscientific domain, which you're not really familiar with and you people haven't really been trained on, is very, very important. And to do that, you have to be curious, because there is no course that you have to take. You already have your engineering degree, so you don't have to take a course anymore. But it's really important and necessary to learn these other aspects as well.
Yes, thank you so much for mentioning it, because we have many students who are contacting us and are asking about how to proceed with the neuro work with the degree and engineering skills, degree in engineering or computer science and those skills, and how to proceed into neuroscience. So maybe we can start with your own example. How did it happen? Because you just told us that, yes, you received this degree in engineering, but then you found yourself in neuroscience. So neuroscience related work, brain computer interfaces, you work in Futscheller's lab. So how did all this happen? And also what helped you to develop all those additional skills? What did you do?
Great. So, as I mentioned, I got my first master's degree from Graz University of Technology in Austria, where I worked with Gerd Furcheller, one of the preeminent EEG experts of its time. He was one of the pioneers of the field of brain-computer interfacing. So I was working with him in his laboratory and decided to do my master's thesis with him. And I was being sent to Albany, New York to work with another BCI pioneer, Dr. John Woolpaw, on my master's thesis. At that time, I really didn't know really anything other than engineering. I didn't know about neuroscience. I didn't know really about science. I didn't understand that there are people that write papers and, whose job it is to do these things. I didn't know. But of course, I learned. So I joined John Woolpaw's laboratory. And of course, people there, I started to understand they write papers, they run studies, and they wanted an engineer to help them write software. So I was very happy because I could actually do something that was actually useful. So it was very satisfying because I could write computer software that would help people to run their experiments. I could analyze the data. And so that's how it all started. And I started to understand, mostly from an engineering perspective at first, writing code that would analyze brain signals, really not understanding too much, but having the first contact. I really got exposed to neuroscience even more. A few years after I arrived, I already had the second master's degree, when I got in contact with Dr. Eric Luthart from Washington University in St. Louis, who is a neurosurgeon, and told me about these patients that he has that have epilepsy. And these patients get electrodes implanted on the surface of the brain, not on the scalp or inside the brain, but on the surface of the brain, to evaluate their epilepsy prior to epilepsy surgery. And we together, and also together with Dr. Dane Moraine from Washington University in St. Louis, got very excited about this concept to use these patients that already have electrodes implanted for brain-computer interfacing experiments. And that was really the time when I started doing my own research, of course, together in this group with these kind of data, with these kind of patients. So I started to understand these brain signals better and started to learn what they mean and how they change when people move or speak or listen to sounds or have any other kind of motoric or sensoric or cognitive experience. And that was a very exciting time, both because that was sort of my first contact with neuroscience, but also aimed with the medical domain because they are patients with epilepsy. So I had a lot to do with neurologists and neurosurgeons. So I started to be exposed to these different disciplines, neuroscience and the medical domain. So that was very interesting. But also the nature of these signals, they're called electrocorticographic signals or ECOG. At that time, they were typically only used for clinical purposes, this evaluation of people's epilepsy. But they're not used for neuroscience or for engineering applications. So without really knowing what I was getting myself into, all of a sudden I'm learning these new skills in neuroscience and medicine, but also I am exploring and starting to really pioneer the use and the research use of a completely new imaging technique, brain imaging technique, electrocorticography, that previously had really only been in the realm of doctors and neurologists that, of course, typically don't have these engineering capabilities and also potentially don't have that interest. They work with these patients because these patients have epilepsy. They don't work with them for neuroscientific or other reasons. And so it was a very, very exciting time. I learned a lot and really got exposed and essentially taught myself both the most important aspects of neuroscience and important aspects of those brain signals. And of course, the important aspects of the relevant medical domain in neurology and neurosurgery.
Thank you so much. Can you maybe recall what questions were you asking yourself when you were just getting into this field, when you were figuring out all those signals? What were you focusing on? What you were trying to figure out?
We had a very specific goal at first, which was to replicate brain-computer interface systems that before had been done with scalp-recorded EEG signals in John Wolpol's lab, in Gerd Furcheller's lab, in other people's lab with scalp-recorded EEG, or in experiments with non-human primates with electrodes implanted within the brain. Our first goal was to replicate and extend those experiments to this new type of signal, to these electrodes that are placed directly on the surface of the brain. So that was our first goal. And we had our first publication in 2004, which actually is still one of my most highly cited publications today. It basically showed that we could teach people with these electrodes that they have implanted very, very quickly to use imagery of motor movements, like I imagine to move my hand, or I imagine to move my tongue, or I imagine to move my leg, for example, and use these different types of imageries to change brain signals in a certain way and use that brain signal to control a cursor on the screen. And while that by itself was not new, because, like I said, it had been done with scalp-recorded EEG before, and I'd been exposed to that before, but now we're doing that with these new types of signals. And these new types of signals are much more pure and much, much cleaner than these signals that you can get on the scalp. So the result that we were getting were very fascinating. People learned how to control this cursor very quickly when it really takes typically a long time to learn that with scalp-recorded EEG. So very exciting time. And that was really my first exposure to these type of signals and to these type of experiments.
Thank you so much. And because you had prior experience working with the non-invasive signals, yes, with scalp recording, Then you started working with the ECOG. If you can summarize the biggest difference that you noticed between one and another. You already mentioned some, but maybe just to summarize this biggest difference between scalp and intracranial recording that you saw for the first time.
Yeah, this is a really interesting question. I think the answer has several components. One component is what's the difference in terms of signals recorded on the scalp versus signals recorded on the surface of the brain? So that's one component. Let's start with that. If you put electrodes on the scalp, it picks up electrical fields that are generated by neurons inside the brain, of course. Well, there's quite a big distance between the neurons producing electrical fields in the brain and the scalp, of course. It's at least 1.5 centimeters or even 2 centimeters, so something like this. And so it's pretty clear that the electrodes are just far away from the neurons that produce these fields. And they're also at the same time much closer to sources of interference from the environment, electrical fields from power supply, for example, or from other sources, or movement, or muscle movement, or body movements and things like that. Versus we have electrodes that are directly placed on the surface of the brain. They're in direct contact with the brain. They're in direct contact with the neurons, or at least in very, very close proximity to the neurons that produce these electrical fields. And they're at the same time much farther away from the sources of artifacts in the environment. So it's the signals are, in a simple way, the signals are much cleaner, much better. There's also different types of signal signatures that we can see with these ECOG signals, and only some of them we can see on the scalp. Like you can sort of imagine if you put the EEG is sort of like putting a microphone outside the stadium. If you have a few microphones outside the stadium, you can see, over there it's a little louder over here, so maybe they just scored or something, or it's louder over here. So you know that this team scored or that team scored, but that's all you know. You don't know anything more. And it's basically impossible because you cannot hear individual voices. You really don't know exactly what's going on, but you can get some kind of information. So the ECOG signals are really sort of like, you can think of it as putting microphones maybe 10 meters, 30 feet or something above the audience or the players. So now you still can't hear individual people talking, but now, of course, you have a much, much better appreciation. You now understand different sectors. You understand if there's a problem over here, you know exactly what's happening. If it's a soccer game or something, you would know kind of where the ball is or something, because you kind of know where the people are, making noises or something. You don't know the individual players or people speaking, but you have a much greater detail. And this is sort of what the ECOG signals are compared to the EEG signals. So that's the first component. These ECOG electrodes pick up signals that are much better. When a person does something, you can literally see how their brain signals change. It's actually quite remarkable. And I will never forget this. So we would have simple experiments when we said, can you now think of speaking? And you see like some brain signal, and then all of a sudden the brain signal completely changes. And did you now just start thinking about speaking? Oh, yeah. Can you now relax? And then the signal changes. And so you can literally see how the brain does something. And of course, if you use computer software and algorithms, then you can see it even better. And it's extremely, extremely exciting. So this is the first component. What is a completely different dimension is that, of course, we cannot just implant electrodes in normal people just because we want to play around with them and have them do a brain-computer interface. We are using and working with people that have electrodes already implanted for a different reason. So with scalp-recorded EEG, you can just buy a device, you can put it on, you can try it out yourself. It's very easy and cheap and safe. All of a sudden, you can't do that anymore. You have to go to a hospital and you have to convince both a patient to be able to run some experiments. You have to work with doctors, different types of doctors, not just one type. There's neurologists, there's neurosurgeons, then there's nurses, and you have to talk to all of them. And you have to understand that a nurse, for example, she may go in and may give the patient morphine because the patient is in pain. Well, then if you go and you want to work with that patient, well, he just got a dose of morphine. He does not want to talk to you because he's sleeping or he's very happy and cannot really do anything at this time. So you have to start understanding humans and you have to work with the patient. They're not research subjects, really. They're primarily patients. And they're concerned because they have electrodes implanted for a reason. So now you have to establish some kind of relationship. And you have to, like I said, establish a relationship with the different types of medical personnel in the hospital. That really forces you as an engineer or a person who is just not a medical doctor, to learn more about how a clinic operates and what the function is of the different types of doctors and why people get these electrodes implanted and where do they get implanted and why and for how long and what the doctors are looking for. So without really knowing, you're necessarily exposed to and have to learn all these different kind of aspects. And it's really something that's very unique. Other than specific research laboratories that work in this area, there's really no educational path that teaches you all these different things, like the neuroscience and the engineering and the medical domain. So by doing this, no matter what the research questions are and the outcome and studies or something, I mean, all that aside, in terms of the learning alone, it's extremely interesting and extremely valuable.
Thank you very much, Dr. Schalk, for giving all these details and explaining the differences between the intracranial signal and the signal that we're recording from outside. As you were getting more and more into this field of research, working with patients, I'm very curious about how did you develop this concept of real-time functional brain mapping. So this is something that I talked about at the beginning of our podcast. This is how I got to know the work you do. And I know that many people worldwide know you because of this amazing technique that you developed. So if you can tell our listeners about this, that would be wonderful.
Yeah, thank you, Milena. A great question. It really came and originated from working very closely with a phenomenal colleague of mine, Dr. Tony Ritaccio, who used to be at Albany Medical College. He's now at the Mayo Clinic in Jacksonville. A great guy, very good clinician, a neurologist, epileptologist. And I spent a lot of time talking to him because we were trying to do research with his epilepsy patients. And he saw some value from us as engineers doing things that clinicians can't do. So we sort of forged this bond of the clinician who is interested and inspired by the potential of engineering and the engineer who's actually very curious about the medical domain. So it was a very fruitful relationship. So we spent a lot of time talking. And from that talking, I started to learn more about epilepsy. I mean, I don't know, you hear about the disorder and you know that people have seizures, but that's basically all you know. That's all a typical engineer knows. That's all most people know about this disorder. But I started to understand that what you really want in treating this disease is you need to understand where the bad parts in your brain are that generate seizures. And you need to also understand where the good parts in your brain are that make you move and understand language and understand sound and so forth. So those kind of interactions, I understood and I learned that the ways in which clinicians have been identifying those areas, in particular those areas that are responsible for movement and other important functions. And what clinicians have been doing for, depending on when you start counting, like 50 years, for at least 50 years, is to put electrodes on the surface of the brain and put electricity through these electrodes. And if you do that on the areas in the brain that generate movements, for example, all of a sudden the hand may move. Well, if you put in electricity on two electrodes, for example, and then the hand moves, well, you kind of know that that place in the brain makes your hand move. Or if you put electrodes in some other place in the brain, and you talk to the patient, and all of a sudden, the patient cannot hear you anymore, cannot understand what you're saying. Well, you know that that part in your brain makes you understand the words that the person is saying. So this technique and this finding has been used by clinicians for what is called functional mapping based on electrical stimulation. So they would use different electrodes. In the very beginning, they would actually take two individual electrodes and move them around on the brain and stimulate, and then try to see what kind of function that would produce or interrupt. And then they would make a map, and they would literally, in the beginning, actually, they would put little stickers on the brain, so you would know where the different functions are located. And as you can imagine, this is grueling work. It takes a long time. You have to do this over and over again. It's very slow, very tedious, and it actually, because these people have epilepsy, that's the reason why they are there. Their brain is not 100% normal. Their brain is kind of a little, you could say, irritable. So now, if you irritate it with electricity, well, these people may have seizures. So now, over the course of trying to understand how their brain is working and where the areas are that you're not supposed to cut out in the surgery that you're about to be doing, you gave that person a seizure. Then the person has a seizure and then is out for a few hours, and then you can resume maybe. But it's just very crude, very problematic. As I am starting to understand this, I thought to myself, well, there has to be a better way. Well, maybe in our brain-computer interface experiments, we basically analyze brain signals when people move or imagine moving. And we use that for brain-computer interfacing, for allowing them to move a cursor on the screen. Well, but I don't have to do that. I can just basically ask them to move the hand or imagine to move the hand. And then I can analyze the brain signals that come from all the electrodes that are implanted. And I can see with any algorithm which electrodes, which locations change in their brain activity when they move compared to when they don't. So now I don't have to use electricity. I can just ask the patients to do something. And then I run the computer algorithm, and the computer algorithm will tell me, oh, over here, when you move the hand, then over here, there something is happening. And when you listen to a sound, then some other areas are involved. So we started this work in about 2006. By 2010, so in 4 years, we had a whole system, a real-time system that was based on our BCI 2000 platform, which is a real-time software platform we've been developing. But using this software, we built a system that could, in the operating room, could tell and visualize which areas in the brain are responsible for which function. And that really was the genesis of essentially a completely new imaging technique. Actually, indeed, the first new functional imaging technique in neurosurgery in 30 years since fMRI. So fMRI, functional magnetic resonance imaging, was developed in the early 90s. And of course, depends on blood flow, and people have to go in a scanner. That has been used for functional mapping, but it's actually a very indirect method. I mean, you're using blood flow, and while it can show you something, it can show you where the areas are that are responsible for movements and things like that. Doctors really are a little skeptical because it depends on blood flow, so you don't know what happens. Is this the same as electrical stimulation, or is it different? Even with our method, they still have to be convinced because it's different from electrical stimulation, different from the gold standard. But it's a little more plausible because these methods are very similar, or at least they use the electrical signals produced directly from the brain cells, the neurons, directly underneath the electrode. So there's a very close relationship between the parts of the brain that make the movements or the other functions and the signals that we are measuring. And yeah, that's how we started with this. Like I said, about 2006, by 2010, we had the first system that we tried out with patients. By about 2015, we started licensing this system to a corporate partner, and that partner by about 2020 got FDA approval for this new device. So a very exciting development, taking this completely new imaging technique from really basic research, you can say, to engineering, to clinical testing, clinical validation and optimization, to licensing and commercialization, and eventually to clinical applications. So all the way from basic research to actual changing people's life with a completely new imaging technique that didn't exist before. So very, very exciting to be part of all of this.
Yes, and again, you needed to acquire new skills, and with the commercial skills development and partnering with the company and so on and so forth. So again, you were learning and learning and learning. I'm very curious about the impact that you created on patients. In regards to that, maybe you can recall one case that really stood out for you in which the system you developed made a real difference.
Well, there's actually quite a few cases like this. And it goes back to the description on the limitations of electrical stimulation. When you actually see how the doctors are stimulating a person's brain, you can really appreciate how crude this is. It's a very, very crude method. And as I mentioned earlier, it can lead to seizures. So you can stimulate a certain part of the brain and people would have a seizure. Well, then maybe you cannot continue mapping anymore. And while maybe the epilepsy surgery is scheduled for the next day. So now you have a patient who has only been mapped in part. So you don't really quite understand the anatomy and the landscape, if you so want, of this person's brain very much. But you're kind of forced to now do the surgery knowing not so much about the patient. That's, of course, not ideal. But now with our method, we can actually go in and we can very quickly, with essentially no risk of seizures, do mapping very quickly so that within just a few minutes, we have a very good understanding of where things are in the landscape, so to speak. We've had this kind of experience several times where we provided our mapping, either because, like I said, there were complications with electrical mapping, or we did our mapping at first, and then the clinician would just go in with electrical stimulation and just verify the results that we found, just to make sure, to make themselves more comfortable. The areas that we've identified are also the areas that they identify with their method, but now they can go directly to the place that they essentially already know where it is. So we've had quite a few situations like this. Now, in the process, we also had quite a few really interesting sort of medical situations that we encountered. I recall one person, she had electrodes over an area in the brain called the hippocampus that's related to memory. My colleague, Dr. Itachio, was stimulating different areas in the brain. And when he stimulated this particular location that was in close proximity to the hippocampus, the person would all of a sudden say, "Oh, there she is, the witch from the Wizard of Oz." So she would see the witch from the Wizard of Oz every time we would stimulate this particular location, not just once. We would then stop it, and we couldn't believe it ourselves. And then we would say, "Well, do you see something now?" "No, no, no." "Do you see something now?" "No." And then we would stimulate, "Do you see something now?" "Oh, there she is again. I see the witch again." I mean, just incredible. It actually gets you, working with patients like this, you get very, very close to the brain, and you can start to understand how it produces our experiences and our imagination and our memories. And you can really work with the brain in this very intimate kind of way, even though it's technically still crude in many ways. It's really the only circumstance where we have this direct access to the brain. So that was very exciting from, really lots of different perspectives. Very exciting experiences.
Yeah, thank you so much. Obviously, all those experiences inspired you to further study the human brain up close and personal. And you developed different projects and collaborations with the various scientists across the globe. What is maybe one study that you are particularly proud of?
By working with these patients and by using these electrodes and the signals from these electrodes, it became very clear that they can be useful for not only for brain-computer interfacing experiments, not only for this functional mapping technique that we just described, but also to achieve a better understanding of the brain and a betterment of neuroscience. Again, when you think about at that time, there really were only three imaging techniques that were in common use when we started. There was scalp recorded EEG that's been around for a long time. That again is cheap, easy, and safe. But of course, it cannot tell you where things happen in the brain. It can only tell you when things happen in the brain. And even that, not so great. But of course, it's very easy. Or recordings from individual neurons inside the brain. Now you're recording from individual neurons, but you really don't know what happens across the brain. So now, for the first time, we actually have a technique that can give you both in space and in time very good resolution. It can actually show you how the brain signals progress from one area to another. This is really something that no other technique can do in this way. And it became clear by working with these signals that they have this capability. We first started by replicating simple studies that have been done in monkeys 30 years ago, people moving a joystick or moving their hand around in space, saying different words, listening to different tones. And we could see, that there's something happening in the brain at this location or that location. And we can learn really amazing detail of function from these signals. We can learn what sounds they're hearing. We can learn where they move their hand, where they imagine to move their hand, where they intend to move or actually move. We can learn whether they look in the center but pay attention to this object over here or versus paying attention to this object over here. We can see all these things from brain signals. We played Pink Floyd, the song The Wall, to many, many patients and actually were able to reconstruct the song, the actual song, from recordings directly from the surface of the brain. There was actually a study that we just got published less than a year ago with a great collaborator, Dr. Bob Knight at Berkeley, and just another terrific colleague who we've been working with for many years. So really terrific detail that we can extract from these brain signals recorded from the surface of the brain. What I found perhaps the most exciting was the combination, not only the fact that we can decode and understand and see all these different aspects of function in the brain, but we can actually see how the brain communicates itself from one area to another. And we can follow, if you so want, the brain signal in real time, in single trials. So, for example, imagine a person sees a flashing light and they're being told, when you see the flashing light, when you see this visual stimulus, I want you to push the button with the right hand. Now, we know from just basic neurophysiology and basic anatomy that when you see something, the light goes into the retina, goes through the optic nerve, goes back to the back of the head in an area called the occipital cortex or visual cortex, where a lot of the visual processing is happening. So we know that. We also know that when you move a hand, just like when you push a button, the area on the other side, so not the same side of as the hand that pushes the button, on the other side, the contralateral side, there's a certain area in the brain, hand area motor cortex, that makes the hand move. So somehow, of course, when I see a light and I respond by pushing a button, there has to be some activation in visual cortex and then some activation in motor cortex. But of course, nobody could really see how these areas would communicate because we didn't have an imaging technique that would allow us to do that. So the EEG is basically not accurate enough. The single neuron recordings, they're only in one place. So we can put them back here or up in the front, but we cannot cover the whole brain. We could also do fMRI, functional magnetic resonance imaging, but that again is based on blood flow, and that takes many, many seconds to develop. So whereas this process is rather fast, it happens, of course, as you can appreciate, you may respond in 300 milliseconds or something when you see a light, right? The reaction time. So fMRI cannot capture that. So electrocorticography is really the only technique that can, in theory, capture both the spatial detail and the temporal progression of these activations. And we started to study this kind of brain internal communication and developed several different new algorithms that would allow us to see this progression in a detail in a way that just wasn't possible before. And there's many striking examples where you can literally see how neurons get excited in visual cortex, and then it's almost like you turn on the Christmas tree, the light goes, you know, and you can literally see how the brain does this. It goes motor cortex, button press, and then it goes to sensory cortex as you get the sensory feedback back from the button press. And you can see how this happens in the brain, and you can see it in individual trials. You do that one time and you can follow how this all happens. I mean, it's incredible. This ability to see how the brain does something is really, really so fascinating. And we were at a place where we were basically the first people in the world that had seen the brain do things like this in this way. So that was really very exciting. And again, totally learning something new, and you start to appreciate and understand how the brain communicates. Then you can start to ask yourself a lot of questions. Well, why is it then that when you do the same task, that one time you respond in 200 milliseconds and one time you respond in 400 milliseconds? Is it because the brain signal one time goes like this, very directly, and one time it goes like this? No, it's not the case. They go the same way, the same brain networks when you respond quickly and when you respond slowly. Well, but then why is it? Because action potential conduction velocity, for example, that's the velocity of action potentials, the actual neuronal communication in the brain, that's very, very similar. So, I mean, that could account for variations of less than a millisecond, maybe, but not like 200 milliseconds. Well, why is it then? Well, the answer would probably take another podcast to talk about, but we can see and we can now understand why that is, for example. And the answer is actually very closely related to many different phenomena. Like, for example, when you hear a sound at perceptual threshold, like meaning a sound that you respond to only 50% of the time, it's so silent, so quiet, that sometimes you can hear it, sometimes you can't. By definition, perceptual threshold is defined as the loudness of a sound when you respond only 50% of the time. Well, why is it then that 50% of the time you respond and 50% of the time you don't? Well, the answer is actually very closely related. Again, it would take a long time to explain, but it's very closely related to why it is that the reaction time in the brain, so to speak, sometimes is fast and sometimes is slow. So there's really exciting things that you can start seeing, and really totally a new area of research, a new area of understanding of the human brain, just an absolutely exciting time.
Yes, absolutely. And this reminded me about the conference that I organized many years ago when I just came to work at Florida Hospital and to establish brain-computer interface and functional mapping program. You came as our guest speaker. So I'm still grateful to you for doing that. And you started your lecture giving a quote and talking about the activity of the brain as a language that we need to learn to understand. So all this work that you did with ECOG, how did it help you to understand the language of the brain better? What did you learn that wasn't possible before you started working with ECOG?
This is another really great question. It goes to the saying that many people have said, and it's very common. They said, neuroscience is data rich, but theory poor. And what they mean is, well, you collect a lot of data, and then when you are trying to explain how the brain does something, you have a lot of theories, but they really only work in very narrow domains. So, for example, we can start to understand decision-making tasks, for example. Well, if I have a choice between pushing the button with this hand or with this hand, and there's some kind of task where I have to decide whether it's one or the other, then there's some kind of theory about how the brain does this particular task. You can make the task more difficult, and then we would have an understanding of what would happen in the brain and where it would happen in the brain. But it's very, very narrow, and there's many of these small theories. But what we didn't have is many good ideas about how does the brain overall work? How does the brain coordinate our actions? And of course, I'm not claiming that I have a complete understanding now. Even the things that I think I now understand, fully developing them would basically take my whole life. But I do believe that by studying these ECOG signals, I started to get a much, much deeper appreciation of how the brain operates. And so this is actually a study that we're finalizing right now. It's been in development for many years, but a study that we're developing now and finalizing now that we call the cortical simulator. So we actually started to, as sort of a result from a lot of the other studies I talked about, develop simple rules of how the cortex operates, and then use these rules to make a computer program that would simulate sensory cortex and motor cortex or different sensory cortices, and then simulate different tasks. Well, what happens if you have visual stimulation and you respond with a button press? Well, now you have visual stimulation with a loud stimulus, a stimulus at perceptual threshold. Well, then what happens to reaction time? What happens to behavior? What happens if you give multisensory stimulation, you give auditory and visual stimulation at the same time, at different times, and so forth. So, and we were able to, with very simple rules, be able to explain all different kinds of behaviors that have been shown in many other studies before. So what that tells me is that, of course, I'm sure there's no theory, no simple theory will always be right and will be perfect. This is really one of the first concepts that actually starts to get towards having a more holistic understanding of general principles of brain function. That's really also something I've been very, very excited about. And I think in the long term, those kind of concepts will have a lot of impact.
Absolutely. And we're looking forward to this new study to be published and to read it. Thank you so much. You didn't stop there. Of course, I don't think you ever stop, but I'm just getting to the next step. You also develop an adaptive neurotechnology program, which also was teaching other people how to get into the field of neurotechnologies, was giving very important information and practical training, which I also attended. I'm so happy I did. Can you tell more what is adaptive neurotechnology? And I think it's such a unique program, probably the first in the world program of this kind. So that's why I really would like you to speak at least a little bit about it.
Yeah, we were fortunate enough to attract a big center grant from the NIH to our institute in Albany. This is a big center grant that's 5 years, can be renewed. It has been renewed now as a second time. One of the major components or the purpose of the center is to develop new technologies in the area of adaptive neurotechnologies, brain-computer interfacing, and related areas, and also apply them. And a big component of all of this is a training course that would teach all the necessary engineering, physiology, medical, neurological concepts to people that are at a certain stage in their careers. Because as you pointed out, I mean, nobody learns about all these concepts at once. I mean, some people are engineers, some people are medical doctors, some people are psychologists. While there really isn't any educational program, there's some, and now an increasing number. Some are very good and some are not so good. Neurotechnology sort of specializations at certain universities, but it's still relatively rare that you get this comprehensive expertise and comprehensive knowledge in all these different areas. So for both that reason and also because it was mandated by the center grant that we had to form a course that would basically teach these concepts. And that's what we did. So in the course that you attended, we had, I believe, 24 participants from many places in the United States, and they had to satisfy quite a few criteria so that they had to be at a certain stage in their career. They had to work in an area where they can actually then, there's a reasonable likelihood that they would actually then use the things that they are learning in some way and not just go because they're interested and then they leave. So that's what we did. There was a lot of in-house training. We had faculty from other areas in different disciplines, from different universities and different places in the country, and they would teach on site for 3 weeks. As you pointed out, this is really one of the first, if not the first, training course of its kind in the world. And I believe it's been a great success, and it's still ongoing.
Yes, absolutely. I was so inspired by it that I offered a course based on what I learned, and of course, adding all my expertise, the course like this at Vilnius University, where I'm still teaching graduate neurobiology students. And we're expanding because we had just theoretical part, and now we added also a practical component. So we got some equipment, and our students are already doing hands-on experiments and analyzing the data. So that course really created a huge impact on me and now on generations of students. So thank you. We all appreciate it.
Okay, that's good.
So thank you for explaining that. And then there is this new project that you are working on with the voice recognition. So recognition, the intent of the voice, yes, different modulations of the voice, but I would like to learn more and predictions. So how did you come to this project? And can you tell more about it?
Yeah, this really started with a lot of the research we have done with the ECOG signals, starting to understand language and emotions in brain signals. So we learned that it's possible to learn a lot of details about language and a lot of details about human emotion just by listening to brain signals. And that's very inspiring. Of course, there's a lot of basic neuroscience that is very interesting. But of course, this has no application. I mean, if you want to know something about them, you cannot just implant them with some electrodes. This really happens only, of course, in very limited circumstances. So I've been thinking for a long time, well, how could I actually take some of that understanding and translate it into something that would actually be useful? And I realized that the tone of the voice is actually, in many ways, not too different from brain signals. In fact, it actually sort of looks almost like EEG or ECOG signals. And it also, the ways in which it's analyzed is very similar. And I understood that while many aspects of voice have been studied for a long time, like the words that you're speaking, for example, they've been studied for a long time. It's a whole field called natural language processing, or NLP. It's been around for a long, long time. And it really started in computer science in probably at least the 70s or 80s or something, and producing understanding that you can, in fact, analyze the words that are in sentences that people speak and can derive useful information from this. And that would go from computer science to then different type of domains like the financial markets, for example, and would then lead to products that would provide useful information. So, for example, a dictionary that was developed about 10 years ago, it's very famous in the field of financial markets, called the Lackland-McDonald Dictionary. And that dictionary says that, well, if an executive says these words, that's actually indicates, has a positive meaning in the context of financial markets. If they say these words, well, then it means that it's negative. So if there's something bad happening about the company, then they tend to use these words. If something good happens, they tend to use these words. So that's, of course, something that investors are interested in and other stakeholders are interested in learning. And we understood that that's the case. But what hasn't been available for systematic study is something that is actually maybe even more integral to emotional communication. That is the tone of the voice. And that goes back to both social psychology literature, and it goes back to neuroscience. Like the neuroscience aspect is the words that we're speaking, they're produced predominantly by the left hemisphere in the brain, at least in most people. So if you have a stroke on the left side in certain areas in the brain, you can no longer speak. However, the tone of the voice, you would call that prosody, for example, that like how your inflection, how you modulate the tone of your voice. That is governed mostly by the right side in your brain. So that's why if you have a stroke on the right side of your brain, you can still speak, but you may sound like a robot. So we understand that from the very, very beginning, even inside the brain, how you speak the words and what you say is completely separated. We then know from the social psychology literature that indeed there's famous papers saying that about 40% of the information in the message is in the tone of the voice. And of course, people debate about the 40% and what it is. But the basic concept is what you say and how you say it is not the same. From basic social interactions, we know that if, like the man forgets to take out the trash and the wife looks at him and is mad and he says, "Hey, what's wrong?" And she says, "Nothing, I am fine." Well, it's not fine. Okay. It's not fine. The words are positive. The tone is not. Okay. My colleague Sean Austin and I, we started to understand that there's a completely important part of our communication that currently we can sort of as humans understand, but cannot understand on a systematic basis. And that's really the basis for this idea that, well, maybe we're not using brain signals, but we're using voice signals to understand with the same kind of techniques that we now know from neuroscience, and with using those kind of techniques to understand the tone of the voice. That's when we basically started a new project and a new venture that's called Helios Life Enterprises that sets its goal to make this new information, or this information that we understand as humans anyway, but make that available systematically and in a way teach computers a little more about human emotions. And we're doing that in the context of financial markets. There's different ways that one could apply this. For example, it could be applied in the medical domain for diagnosis of disease, Parkinson's, for example, or other types of disorders. It could be applied in call centers, for example, when people get upset and then have machines understand that people get upset. We decided for different reasons to apply it in the concept of financial markets, where, again, investors may be interested in understanding whether an executive, well, he says a lot of positive things, but actually he sounds pretty negative. Well, that's probably means something. Actually, in this context, I think it's just interesting to know that both facial expressions, body language, and the words that you're using are actually used by humans a lot of times actively to steer the communication, or you could even say to manipulate others. So, poker face, for example, right? You show poker face. Maybe you're bluffing, maybe you're not, or something. Humans use these channels all the time to manipulate others. Well, you really can't do that with the tone of the voice. If you just had something horrible happen, you cannot sound exuberant. That's very difficult to do. Or you can't sound depressed when you're actually very excited about something. It's really hard to do. Maybe you can be trained to do that, but if you can, it will be very difficult. So it's really something that if we want to learn more about people and more about their emotional context, the tone of the voice is a great place to go. So that's really the culmination. A lot of the engineering work and a lot of the neuroscience I've done over the years that, of course, is very exciting, often cannot lend itself to applications that make people's lives better, except, of course, we just talked about this functional mapping before. But even that, that's in a lot of ways, as exciting as it is, it's useful for neurosurgery in a very, very narrow domain. Right? It's useful for this very specific application. This capability, if we can teach computers how to understand humans better. That could have a lot of applications in really many, many different areas. For all these reasons, that got us very excited. So that's now an important project that have been involved with and have been driving for quite a few years now.
Yes, that is very exciting, and it's very interesting to see that progression. That knowing how to analyze the signal, you were able to really do amazing analysis of the brain signal, and then all that experience that you accumulated analyzing the brain signal, now you are using already for processing of the sound, yes, of the sound that you collect from people. So how everything is really connected and helping each other. That's beautiful. In regards to this project, just a quick question, which I became very curious about after watching some of your YouTube videos. In one of the videos, you mentioned that you have a list of people, at least people listed in terms of the amount of that recognizable inflection in their voice. So, if I understood correctly, and number one, you said that it was Elon Musk, and actually, based on his voice inflection and the data that you acquired, you made a very interesting prediction, which turned to be true. Can you a little bit maybe talk about this?
Yeah, that was really terrific. So the as you pointed out, by understanding the tone of the voice, we can now start to understand how the tone of the voice is related to things that happen to the firm in the future. Like, for example, and you can understand that in very simple terms. So maybe the executive is being asked about the toxic waste dump in Alabama that was just found, and they say, "Oh, this is." They know it's a big problem because they've just talked to their attorneys about it, so they know it's a big problem. But of course, they are being coached that they will, of course, give a very politically correct answer, right? So they will say, "Oh, it's no problem" or something, but their voice gives away that there is an issue. Well, if it does that, and you know that, you would know that maybe a quarter later at the next quarterly earnings call or something, maybe the toxic waste dump is now known to be a big problem, and now the stock price changes, or the company's performance is affected in some negative way. So the bottom line is the tone of the voice is useful in the context of financial markets to learn something about how the firm is going to do or maybe doing in the future. And of course, it's not a crystal ball. It won't be correct all the time. And of course, there will be executives that are an open book. And Elon Musk is a complete open book. If he is pissed, he will sound pissed. If he is happy, he will sound happy. Well, you talk to Tim Cook always sounds the same. So the amount of information in his tone of the voice is much less in Elon Musk's voice. So we internally, and we never publicized this or published it or anything, but we had an internal listing of the, as you point out, of the top executives in the country, ranked by how much information they give away in the tone of the voice. And Elon was number one. So what happened was this was actually relatively early on. This is several years ago. There was a conference in London, and we made a very bold prediction based on analysis of Elon's voice. And we found particular characteristics in his voice that were very indicative of basically very positive signal, so on, in simplified terms. So we made a very bold prediction on stage in London, a forward-looking prediction that Tesla is going to break its all-time high. Now, I don't remember exactly what Tesla was at this moment, maybe 200 or something. So that was very bold, and we said it would happen within the next quarter. So a few days later, Elon introduced, after this earnings call, their quarterly earnings call that we analyzed, we have the quarterly earnings call. We then had the conference in London where we made this prediction. A few days later, Elon introduces the Cybertruck. And that was a disastrous presentation. The stock price went down. We are ripping our hair out because we're like, this is so embarrassing. We're so completely wrong. And then the stock price was just like skyrocketing. And it went to like 800 or something very quickly. So our prediction was correct. It was very bold. It was spot on. And of course, this was in front of hundreds of people. So this was not like after the fact or something. This was in front of hundreds of people. So that was quite exciting. And then actually, based on that story, there was another conference just a few months later, and I told that story live on stage in a different conference in New York. And then we had a competition of about 30 different pitches, if you so want, and we won with by far we were number one out of these 30. So that was very exciting with this Tesla story, very exciting story that was based on the tone of the voice of Elon Musk.
It is. It is very interesting. I think this is what I watched, those speeches. It was like 3 minutes during which you need to present your project.
Yeah.
Yes, so it was successful. Very good. Very good. Excellent. So it brings me now to your current work in Shanghai. Yeah, so step by step, I'm sure there were many, many other projects in between, but at least we went through the main ones. And now, what do you do in Shanghai? Can you tell about your work and also, your future steps? Where are you planning to go from there?
I just talked about for this commercial venture about this desire to actually do something that really changes people's lives. So we're doing that in this commercial domain with this voice tone analysis I just described. Another way to do that would actually be to take all these neurotechnologies that have been developed and tested either in animals or in humans and have been really applied and shown success with in hundreds and hundreds of demonstrations, take them and make them into solutions that improve the lives of many people, to improve the lives of mass populations. That's really motivated by a very deep frustration in a way that comes from the exciting promise on one hand that these neurotechnologies have. While we can now interface with the brain, we can understand how the brain works, we could use it to diagnose disease, how to treat disorders. We could do all these different things. And we have a lot of biological insights. We understand the brain better. I just talked about some before. We have a lot of technical breakthroughs. I talked about ECOG recordings. There's new algorithms. There's new devices. There's a lot of interesting technical breakthroughs. And both the improved understanding and the breakthroughs, they lead to technical demonstrations. Well, there's technical demonstrations how we can now treat people that have aphasia. We can decode people's handwriting from their brain signals. We can restore speech by recording brain signals. We can do all these exciting things, except, of course, at the end of the day, we barely have any solutions that actually are changing people's lives. So that's a very general frustration. And really, this issue that even though we have all these demonstrations, we really don't have solutions that change people's lives. That's something the field has actually kind of been aware of since 2002, when I think it was the second international BCI meeting that was held by our group in 2002 in upstate New York. And the name it was aptly named Brain-Computer Interfaces Moving Beyond Demonstrations. So even back then, the idea was, well, we want to take this out and actually want to do something. Well, now we're 20 years later, and we haven't done a lot of translation. So that's very frustrating in many ways. And I told you about a success before with this functional mapping, but in general, the field has really not been able to take a lot of the successes and the demonstrations and make it into solutions that change the lives of many people. We don't have enough time to go into the details for why that all is, but what we're trying to do at the Chain Frontier Lab for Applied Neurotechnologies, which is the really R&D component of the Tianqiao and Chrissy Chain Institute, which is a philanthropic organization dedicated to supporting brain research and development. And what we're trying to do is to develop technologies that are going to make that jump. And there's a careful analysis of why it is that previous demonstrations haven't made it and what do we have to do to actually make it. There's actually a review article that I'm now working on with several co-authors that very soon will go to Nature Reviews Bioengineering that actually talks about this problem and potential solutions. And the solutions we're trying to incorporate, or we are now incorporating into the work that we're doing at the Frontier Lab, whose mission it is to improve people's lives with neurotechnologies. And as part of this, we are developing a completely new multimodal EEG recording system. It's called Smart EEG. You can put it on your forehead. It has 2 channels of EEG. It has a motion sensor. It has a microphone. It has SpO2 measurements, so it can, or PPG and SpO2, so it can measure heart rate. It can measure oxygenation. So it can do all that in real time. It's fully integrated with our BCI 2000 software platform. So it's essentially a very powerful hardware software platform that's extremely practical. And that's been a source of a tremendous frustration because a lot of even the translational neurotechnologies that people have described and are described in studies, many of them are actually very successful. The non-invasive ones, but there's many non-invasive ones that are very successful. I spoke about aphasia training. Well, you can diagnose people that have depression. There's many examples of that. You can have cognitive evaluations of people with that either have mild cognitive impairment or dementia. You can tell them apart. You can tell the normal people apart from the people with mild cognitive impairment and the people with dementia. Well, wouldn't that be great if we could just have that capability and you didn't have to go to a clinic? A lot of the studies in this area, they would use 64-channel EEG, and they would use a postdoc, and the postdoc has to set up the study and then collect the data and do a lot of data analysis and very careful data analysis. And then maybe you can show something. Well, that's great that you can show that or that people can show that. But what it doesn't do, it doesn't make it a practical system that actually can be applied. And this is now what we're working on. And the hardware I just talked about is basically just the sort of the hardware interface, if you so want. It's basically a flexible patch, so it actually can flex like this. It's about this big, and you put standard electrodes on the back that are embedded in a sticky patch. So the whole patch is sticky. It has electrodes embedded in them. They are similar to EKG electrodes as they are used everywhere in the world. You clip them in, and you simply take the device, you put it on the forehead, and then you can run some kind of computer program and some kind of system that interacts with it and executes a certain protocol. So it's in its combination of both the multimodal data collection, of the real-time closed-loop ability, and powerful protocols associated with it. It's really a capability that's completely unique worldwide. So we have EEG helmets, of course, for research purposes. Now we have EEG devices that are for consumer use, but they still are maybe hard to put on, or maybe they are expensive, or maybe they only do EEG and not other signals. So they have all kinds of limitations. Our device is multimodal. We produce it ourselves. It's very cheap to produce. And the plan is that we will provide it to thousands and thousands of people, to many researchers that can use the system for their own studies and do it basically in a way that's a completely different paradigm. It would take the application away from the postdoc who is funded on a grant and is spending months and months setting things up, into a situation where a normal technician can maybe use it, or maybe even the person at their own home can use it. And, for example, sleep with the device, and so that the device can provide an understanding of the person's sleep stages, for example. And so that's really part of the initial work we've begun at the Change Frontier Lab for Applied Neurotechnologies, and really a very exciting work, again, trying to make people's lives better. And that's really sits on the sort of tail end of a lot of the basic research and basic engineering and developing techniques, really putting all this together and now starting to make solutions that actually will improve the lives of many people worldwide.
Yeah, that's beautiful. And I wish, of course, all the best with this development. Now we'll look at everything you did so far. What do you think is one main skill that you have that is transferable that helped you to go from one project to another and be able to complete all of them so successfully?
It's certainly not a technical skill. It's certainly not, this computer program or something. I think curiosity is probably number one. Really being excited by and curious about things, not just excited about like the kind of things you know, but actually more excited about the things you don't know, because then you learn about the other things. If you always stay with the things you know, you'll know a certain programming language, you will apply that programming language. You'll never talk to a doctor. You never talk to a neuroscientist. If you're a neuroscientist, you'd never talk to a clinician. And in fact, that this is actually one of the biggest problems I see all the time. The chance that an engineer or a neuroscientist can work together productively with a clinician is very low, because typically one or both of them just aren't really interested in what the other person can do. They may just say, well, you really don't know very much about my patients, but I want you to help me a lot. The engineer, of course, thinks, well, you really don't know anything about the amazing engineering that I'm doing. And what you're doing with your patients is very stupid because you're doing something that's 30 years old. And so that kind of situation is clearly not going to lead to a whole lot. And that happens all the time. So being open, being excited, being interested in new things, and being like that all the time. And then, of course, having to listen to people that tell you how it's not going to work, and still forging ahead and actually doing something. I'll remember when I first came up with this idea for functional mapping, I talked to one of the premier, most respected neurosurgeons in the United States who is specialized on electrical stimulation mapping. His name is George Ogerman, a very, very senior, very highly respected neurosurgeon coming from a whole dynasty of neurosurgeons. I went to him, and this must have been 2006 or so, and I had my first video of this passive functional mapping that does not use electrical stimulation. Now, that already should have given me pause. Now I'm talking to a person whose whole life was based on electrical stimulation. And I went to him and I said, hey, George, so what do you think? I have this new technique. It does not use electrical stimulation. What do you think? Well, of course, what do you think? He said, well, he gave me a half an hour lecture about how stupid it was, what I just told him, because all these different reasons. And of course, now, I was depressed. Well, not really, but, I was frustrated, but of course, pushed ahead anyway. And so it's, I think, really a drive to change things, a drive, an inner passion. I don't think it has very much to do with intelligence. Of course, understand certain things. There has to be a certain base level of intelligence so that you can do something. But I think the biggest skills are really the curiosity, the drive, the perseverance, and really having this vision. Wow, if we do this, then this is really amazing. I was just thinking when we were doing the study with ECOG and Pink Floyd, having people listen to Pink Floyd and trying to decode the music from the person's brain signals, I was like, wow, if you can do that, you can listen to a person's brain. Isn't that amazing? And you can listen. It's almost like, how they have like the first like recordings of some concert or something that's all imprinted on a wax drum or something, and now we have the device and you put the needle in and you record, you can play it back. You can kind of, it's 250 years old or however old these things are, and you can kind of hear it's kind of this music, but it's music. You kind of know what it is, but of course it's very noisy and not perfect. But you can see, wow, this is 200 something years old, and this is the very first recording. And this is the way I thought, wow, if we can listen to the person's brain and we can hear, what the person is hearing. Now that is incredible. Now, there's really no scientific hypothesis behind this, or not a very good one anyway, but just being inspired by this possibility, or wow, wouldn't it be amazing if you could see how neurons kind of like get excited, and then this one, and then you can almost see the action potentials, not really see, but you can almost imagine like here, and then the action potentials go over here, and then and you can see how that works. Now that is exciting. And so doing something like this and being excited by it, it probably requires a certain personality, to be honest with you. I don't know how to what extent that can be taught or something, but that's certainly in part required. If things like this aren't exciting, if they are too scary because nobody's done it or something, and it's intimidating, well, you're not going to do it if you're intimidated by this. If you're intimidated by, and you're so introverted and intimidated by talking to a famous clinician, well, you're not going to be talking to him. I mean, and you're never going to learn this. And so it probably requires a certain kind of person, in a way, curious, extroverted, passionate, persevering, and probably hardworking. I mean, this is not something that happens in 7 hours a day. It's a lot of work, and all of these things have been a lot of work. And it's now easy to talk about, like I have 100 and something papers and all this record, and there's this business, and there's this new technique or this new device or something. It's all easy to say, but it's a lot of work. And of course, you don't show the things that don't work. There's of course always things that don't work that you think are going to be exciting, but they don't. They don't pan out. So it's a lot of work, but it's been quite the ride. I would not trade it for anything. It's been really the ride of a lifetime, learning about all these different areas. And once you understand how these different areas all play together, you can really, and you talked about transferable skills, you can apply this anywhere. You can, so now I created a business that's in financial markets and does voice analysis. Well, it has nothing to do with ECOG brain signals directly, but it uses a lot of the skills in a different way. Communication, just to be able to talk with a clinician and with a neuroscientist and understand what gets them excited and what they want. It's amazing, and such a critical skill. Like, communication is probably one of the most important skills in all of this. If you cannot communicate with different people in different fields, it's not going to work. Because after all of these things we have to understand, and probably most things that happen that are exciting and really life-changing and category defining and changing, are things that happen at the interfaces of different disciplines. Now we're, on the verge of ChatGPT and new generative AI, and those are primarily the very important new developments, and they happen within the domain of artificial intelligence. They're probably the most important developments in AI in 50 years, but those things happen every 50 years or every 100 years. Most of the time, new innovations come from the interface of different disciplines. And that's why you need people that can actually bridge these different disciplines. That's why you need an environment that exposes people to these different disciplines, not just an engineering school that teaches the algorithms, and then you go over to some psychiatrist one time and get some data and go back and do some data analysis. This is not how it works. You need to go over, you need to be there, you need to talk to the psychiatrist all the time. You need to understand what they do. You need to understand how they make their diagnoses. You need to understand what they can currently do, so you don't do something that they're already doing much better or very, very easily and cheaply. You have to do the things that they can't do, or that they can only do, and it's very expensive or time-consuming or problematic, right? So it's those kind of things, those kind of skills, and they have nothing to do with knowing many different algorithms or writing computer code a certain way or something. It's mostly communication and curiosity, perseverance. And so if I would give advice to anybody, I would say, well, this is what you need. And if you really want to succeed, then that's the kind of skills that you need.
Absolutely. And it's also in line with what Dr. Nicholas Opie was talking in the podcast that we recorded. It's coming up this week. He was talking about perseverance because it takes time. It takes a lot of effort and determination to move forward, whatever is happening. And also, he mentioned, of course, this merge between different disciplines, how important it is, because the stand road that they develop, yes, it's engineering and it's interventional radiology. Yes, something that was used by interventional radiology, but engineered now for brain computer interfaces. So thank you so much for mentioning that. And you already run your own company. You had so many graduate students working with you. What are you looking for in your potential employees, in students that you invite to work with you?
At least in my own work, I've been most successful starting with people that have a very strong engineering basis. Of course, there's a place for everyone. And if it's a big project, and there's always a place for other people too. But the engineering is like writing computer code, understanding mathematics. That's the thing you're not going to pick up afterwards. It's something that requires many years of study. It requires a lot of time. The neuroscience, of course, you have to learn something, but it's not hard to understand. Yes, you have to read things. Yes, of course, you have to remember things. You have to understand what you're reading or something, but it's not hard per se. Medicine is also not hard. You have to, of course, understand some concepts. And of course, if you go through medical school, of course, it's very hard because you have to memorize a lot of things. And I probably couldn't even do that because my memory is not that great. But it's not hard to understand. It's not hard to understand, for example, that you may have a white matter malformation in the brain. So the brain has these migration disorders, for example. As the brain develops, it sort of grows like this. And it can happen that there's a part in the brain that's destined to go to the cortex, to be on the outside of the brain, but it actually gets stuck in white matter. Now it's basically, this is a piece of tissue that's inside your brain, and it's not at the place where it's supposed to go, and it's obviously not wired correctly because it's not supposed to be there. That's one of the common reasons for having epileptic seizures, for example. Well, that part is not hard to understand. Well, what would you do? Well, you do an MRI. You do an MRI, and then you see some gray thing that's in the white matter. You see something that's not supposed to be there. Well, what do? Well, you cut it out. So it's not complicated. So it's not, why you do the MRI is not difficult to understand. I mean, yes, you have to know that these things exist. You have to understand and know about this, but it's not hard to understand. If you talk about a Fourier transform to somebody with a medical degree, well, that's much harder. And you can't. There's no shortcut. You cannot just learn the fast Fourier transform. You have to learn many other things in mathematics too. I only have to know about, like in this particular case, I just have to know about this particular phenomena I just described. I don't have to study all of medicine. I can just understand that. So starting with a solid foundation in engineering, I think is a great way to get in. That's not to say that there aren't great people that have medical degrees that have been successful, of course, and there's many. But I think from a young person's perspective that wants to get into the field, I think having a solid basis in engineering is, I think, very, very useful. And also, of course, a lot of transferable skills that go, if you know how to program and you know how to do mathematics and apply mathematics and statistics correctly, you can do a lot of different things. So that, I think, is a very, very important skill. And if somebody had a choice of what to learn and how to get in, well, learn the hardest math and the most math, the most statistics, and the hardest programming that you can, because that will literally set you up for a lifetime. A very strong foundation upon which you can build with all the other things I just described.
Yeah, thank you so much. I hope our listeners are listening to this advice, our students. Our podcast is called Neurocareers Doing the Impossible. What is something that you may be thought of being impossible that actually proved to be possible in your career, in the work you did, and how did you make it possible?
Really, again, and there's probably several examples, but the level of detail of function that we can learn from the brain is really profound. When I started, we could basically tell, oh, is somebody moving the hand or not moving? We had no idea whether the hand is moving this way or that way, whether the hand does this, or what the hand does. We had no idea. Well, 5 years, 10 years later, we can decode the movement of the hand. We can decode not only which finger is flexing, which of the five fingers, we can decode the specific trajectory of each of the five fingers. I mean, it's ridiculous. It's completely unbelievable. We can learn not only whether somebody's speaking a word or imagining a word, we can decode the vowels and the consonants in the word. We can decode the full words, the full sentences in actually spoken or imagined sentences. This is crazy. I mean, this is completely unbelievable. 10 years earlier, I would have never imagined that we'll be able to do things like this. And like I said, it doesn't just stop with that. It goes on to all these other different types of information that we can find. So, I mean, amount of information that with these electrodes that we can decode from the brain is absolutely mind-blowing. It's just we cannot put electrodes in normal people, because if we could just get access to this kind of information in a way that doesn't require these complicated electrodes, society would change. Would change dramatically. We would have an interface to the brain where people literally would start fusing with the internet. We could make direct communication from our brain directly to the internet. Now we know it's theoretically possible. We know that we can, in theory, do these things, but we really can't do it in practice because it requires brain surgery and all these complications and risks and costs and so forth that are associated with this. So obviously, this is not going to be done in a lot of people for these reasons. But actually seeing what's possible and going from, like I said, you can see that somebody's imagining to move the right hand to decoding full sentences, and that in the time span of like 10 years. I mean, this is really unbelievable.
So, what would be your advice? How to make the impossible possible?
It depends in part on where we are with certain development of certain areas, and of course, we're not necessarily going to know what stage of development we're in and what possibilities are even there. But when I started working with these ECOG signals, these electrocorticographic signals, it was very clear to me these are signals that are really special. They are very different from scalp recorded EEG. They seem so much better, so much cleaner. And if you put more electrodes, you would even see more. It was very clear that there's a lot of potential. And so I focused all my energy on basically exploring these possibilities. I talked about the Pink Floyd decoding and finger decoding and all these other type of work because I was so inspired by this possibility. So now we know that. So now, would we now go and, do more math so we can extract this finger movement even better? Well, that's not so exciting anymore because now we already know that we can do that. We already know that this is not going to change people's lives, directly, right? So actually now trying to make something like this even better, that doesn't seem like that exciting. Well, now what is exciting is to actually take all of this and make it into devices that actually people can use and that change people's lives. So maybe the trick is really the realization of what is the impossible thing that you want to work on? What are the things that are going to lead to something important? Making that decision and having that understanding of what it is that is actually an area that could lead to something useful, that I think is probably pretty important. The actual doing it is already much easier. I mean, not much easier, but it's much easier than that. It's really hard to know what to do. Then, of course, you have to know how to do it. But the first and foremost thing is what to do, because as you just pointed out, these things take a long time. You can easily spend 10 years or 20 years of your life, doing something. And if you point the compass in a slightly different direction, you're going to be spending a lot of time on something that maybe you could have already known to begin with is not a very good direction. And so speaking with people that have experience and really trying to understand these possibilities, I think that's very important before you actually start doing it.
Yes, thank you so much. And from what you just said, what stood out to me that it's important to persevere in your projects, in what you do, like you did. Even somebody said that no, this real-time functional mapping, it's something not that exciting. You still persevered, and it really is an amazing tool now. But also it is important to stop at a certain time and see what's the next step. Yes, like you're saying that already we know so much. We did all of that. Yes, we covered the impact of just improving it slightly here and there. It's really is not big. So you stopped and you found a next area that you want to explore and to contribute. So knowing how to persevere and then to stop, to change as well.
Yeah, knowing the areas that you get in, it was very good that we now know this or that we've achieved this capability. Maybe it's already good enough. Maybe by doing it, it was very inspiring, but now well, this is really actually not going to lead to something. It may be leading to something that's interesting for basic science, but it's really not going to make people's lives better. Well, if you continue trying to make people's lives better on something that you know, you could know, or you should know, cannot lead to something that improve people's lives, well, then the question is really, why are you doing this? Why do you spend your life doing something that you know, could know, or should know is not going to go and actually change people's lives? Even if you're very successful or something, you do the best you can. It just won't do it for certain kind of reasons. Well, if you're in a situation like this, you probably shouldn't be doing it. You probably should be doing something different. Maybe you should focus on some basic work or something that is exciting, or maybe some translational work that goes in a different direction or something. But making these kind of judgments as a young person is really difficult because you don't have the full picture yet. So working with people and getting advice from people that have been doing this for a long time and really are knowledgeable in all these different fields, of which there, of course, unfortunately, are not that many people. But getting advice from somebody like that, I think, is very important in the development. People can learn how to do something, and they can form relationships, they can do all these things. But if you set out on a completely wrong path, then that wouldn't be great. That's definitely very important. I think I agree with you.
Yeah, thank you so much. And you mentioned that our world and our society and the life of people would completely change if we would have possibility to have implantable devices to interact with the world without the use of our muscles, yes, our body. Although we see as at least not possible in the near, maybe 10 years or so, how would you like to see the future of neurotechnologies like this 50 years or maybe 100 years from now? And how that society, do you think, would be different from what we have today?
I think the most immediate way to make a lot of progress is to make the non-invasive technologies that have already been proven in many, many studies to be useful for diagnosing or treating depression, cognitive function, improving function in people after stroke. There are many, many studies that are diagnosing or treating people with ADHD and on and on and on and on and on, actually making solutions from those demonstrations that have already been successfully accomplished. That's sort of a very concrete, more immediate goal that we can achieve with devices that we already have or that we could have with reasonable improvements. I was talking about this patch that we're developing, this EEG patch. That's a device that didn't exist before that we've been developing. We have a great prototype, and we're going to be producing many of them to go in that direction. Now, beyond that, there's, of course, different Non-invasive ways to interact with the brain, of course, they're by definition, they're very crude. We have electrodes that are on the outside. They have a lot of problems, and there will be a lot of limitations that come from them. Maybe we can only use them while we're not moving. Maybe we can only use them while we're sleeping. Maybe we can only use them by playing a computer game or doing some kind of evaluation on a computer like this, but we cannot use it in the subway or something. So there's definitely going to be limitations. Now, the current invasive techniques that are out there, I talked about the echo recordings. There's also stereo EEG. There's microelectrode recordings. You brought up Stentrode. Neuralink has their own form of invasive device. They're all based on very simple techniques to put basically an electrode very close to neurons in the brain. And then the only difference in a way, how do you make the electrodes, where do you put them, and how do you put them in? But in all these cases, it's basically a metal electrode that you have to somehow insert on top of the brain or inside the brain. And that is something that will always carry some risk, will always be expensive. It is a neurosurgery, and neurosurgery is on the order of $50,000 to $100,000 because there's a lot of things that are required. Because it requires these things, it's not like a computer mouse that you buy and attach to your computer. It's not like an app you install on your phone. I think that's something that we need to recognize. That doesn't mean that it's bad. It doesn't mean that it's very dangerous. It doesn't have to be that dangerous. I mean, we get pacemakers implanted or something, but you don't get a pacemaker implanted for fun. You get a pacemaker implanted because otherwise you die. If this device can maybe help you to communicate a little better, but you could also have maybe an eye tracker. You could use an eye tracker. Well, you're going to use the eye tracker. You're not going to be using this brain implant, right? And so the fundamental problem that we're having is that our ways to interact with the brain, invasive or non-invasive, doesn't matter. Our current ways to interact with the brain are extremely barbaric and crude. And we can package it into whatever kind of expensive engineering that we want. And, and it's impressive to look at a Neuralink device with maybe 1,000 channels or something. That's all fine and great. It's still very impractical in a lot of ways. We're not going to be doing this in people just to find out whether or not they have a good sleep. That's not going to happen. We're going to be doing this in people that have a really bad disorder and have no simple alternative. Because if there's a simple alternative, even though maybe it's not quite as good, it won't be used. Like, for example, DBS, deep brain stimulation for movement disorders like Parkinson's, is probably the most successful neurotechnology that's out there. It's currently implanted on the order of 2 to 3% of all Parkinson's patients. Okay. And of course, the reason is because, you would say, they are not all of them are eligible. Well, they are, of course, not all eligible because they are on drugs and the drugs currently work fine. So, of course, you're going to give them the levodopa or something. You're not going to give them a deep brain stimulator. So now they have to be really bad, and then you give them the deep brain stimulator, maybe if certain clinical circumstances are met. So we should not forget that the current ways to interact with the brain are very crude. We are not going to fundamentally change, I think, the situation unless we are developing a completely new technique to interact with the brain that interacts with the brain in a way that is simple, safe, easy, and also has high specificity and accuracy. This is a kind of magic technology that currently doesn't exist, that we currently don't even know what it is, because putting electrodes in the brain in some slightly better way isn't going to fix that problem. It would be something, maybe we can put a little chip here, and that little chip can somehow read our brain in some way. But of course, we don't know how to make that chip. But it's not going to be, we have a slightly better electrode. It's not going to change things. I think the lesson from DBS, it really should give people some pause, because even though this is a very successful neurotechnology, and of course, there are amazing videos on YouTube, and there's great examples, but it is only used in a few % of people. And it is only used in a few percent of people because even though it's successful, it's been around for 30 years, it's actually reimbursed by insurance companies in the West. It's a very successful surgery overall. After all, it is a neurosurgery that costs a lot of money and carries some risk. And then the insurance companies are going to be, everybody is going to want to use the simpler thing much more so than the neurotechnology. So what we really want is, you talked about before about understanding the language. We need to understand the language of the brain better. We also need to have some kind of way to get to that language and talk to the brain in a way that the brain really doesn't know the difference whether it talks to itself or it talks to some outside device. That's what we want. We just don't know how to do it. And there's no technology out there at the moment. All of the ones that we talked about, there's some that we didn't talk about, but none of them are really fitting the bill of providing this kind of seamless interface that I would really envision. And it's really hard to know what that would look like. Maybe the closest is functional ultrasound stimulation or focused ultrasound stimulation. That's a relatively new technique that's quite exciting and interesting because it can actually stimulate deep areas in the brain very accurately in a very focal manner. That's interesting. There's a related area that's called functional ultrasound. It basically does the same thing except reading from the brain. Those techniques are techniques that I think are pretty promising. They're probably not what I just talked about, like aren't going to get to that point, but they are very interesting and they are probably going to open up new areas for application. It's still quite early. There's still some limitations in practicality and access and things like that. We'll see where that goes. But I think my dream device, nobody has come out. I can't think of what it would be exactly. I know what I would want, but I'm not exactly sure how to make it. And I don't think anybody has figured it out. And I haven't seen any idea of something that could make that kind of device. But if we did have it, it would completely change our life. That is very clear.
Yeah, how our life would change, at least how do you see our life different if we have this technology?
If you imagine right now, our bodies have evolved over thousands of years to use our sensory motor system to interact with the environment. We can fly an airplane by using a joystick, and the joystick is made so that it can provide useful functions to a person that has a hand and an arm. And we have 5 fingers. We don't have 50 fingers. We have 5, and they have a certain kind of mechanical composition. They can do certain things. They can't do other things. We don't have 5 hands or arms. We have 2. And the same with our eyes. And of course, those capabilities are very well suited to people that want to make tools and they want to use a hammer and, they want to climb up trees and throw coconuts at their neighbor or something. So they are very well tuned and suited to our environment and to the demands that we had in the past, just like any other species evolved to basically take advantage of the environment that they were in. Now, if we had those kind of techniques and those kind of ways to interact with the brain, because the brain doesn't know. The brain doesn't know that there are 2 hands. There's afferent and efferent, inputs and outputs, and the brain doesn't know. It basically figures out how to use these inputs and outputs in some meaningful way. So at least in theory, with technology that can interface with the brain in some unconstrained way, we could completely eliminate all these constraints. We could directly, literally fuse us with computers and artificial intelligence and really become, what in science fiction they talked as the Borg or they talked as the Hive or something. You could think of like a global organism almost, where like the human brains are directly fused with other human brains and with Google searches and AI. So completely eliminating all the constraints that we have in our current sensory motor system. So I just talked about sounds a little fantastic and a little out there, but I think it would be immediately happen if we had this technical not immediately, it would take some time, but it would clearly be possible and it would clearly be happening if we had this technical capability. We just don't have it and we don't know how to make it. But it's very clear now from me studying the brain for all this time that you can interact with the brain in very meaningful ways. You can train the brain. We can understand its language. We can talk to it. We can make it learn. We can stimulate the brain with appropriate protocols so that there's beneficial plasticity, so that it changes over time. We know how to do these things. Our ways to interact with it are so primitive that we just can't do that in a way that really impacts a lot of people on a large scale because it's so crude and so dangerous or expensive or whatever. But if we could do it in a simple way, then all of that would happen. So anyway, probably not something that will affect our lifetime, but it's very clear that at some point in the future, somebody is going to figure out how to make these devices and how to make this new way to interact with the brain. That would be something that, I would be very excited about learning, because it really would completely change who we are as a human. What does it even mean to be human anymore? Very exciting. Of course, a little frightening to some maybe, but it's like that with all technologies. I think it will be the next step in our human evolution to really merge ourselves with other people and with technology.
Yeah, absolutely. Expanding the boundaries, yes, of who we are. And obviously, our brain would change, the language, the way we communicate, everything would become very, very different. So I'm sure somebody will make that currently impossible possible in the future, like you said. Thank you so much, Dr. Schalk, for this amazing, amazing podcast, so many insights. If somebody would like to learn more about your publications, about your work and current work, maybe contact you, what would be the best way to do that?
I'll provide contact information, and you can post it on your podcast. I'll be very happy to be contacted by email or some other meaningful ways. So I'll make sure that you have the appropriate contact so you can attach it to your podcast.
Yeah, thank you so much. We will add all this information to our podcast notes. And before we wrap up, do you have anything to tell our listeners, any advice to those who are trying to pursue this career in neurotechnologies?
I think neurotechnologies is really a terrific area of research, a very inspiring area of research. It's really an area where you can learn things and you can really be unique in a lot of ways. I mean, now a lot of people study computer science, and there's a lot of, and then still a lot of people are computational neuroscientists or something. But if you're somebody who understands computer science, understands engineering, understands the relevant aspects of neuroscience, understands relevant aspects of medicine, relevant aspect of business development, it basically puts you in a position that only very, very few people in the world are in. To a certain extent, the companies and corporations would be companies like Medtronic, Boston Scientific, or one of the newer neuroscience or neurotechnology companies that are now developing. But clearly, people with this kind of skill set would be eaten up and would immediately find a job. They would be people that could be driving, could become this new frontier in research or development or business. That's really something that I think it's a great area to get in for the right kind of person that is perseverant and, extroverted and visionary and curious and so forth. For those kind of people, it's a great area to get involved and to make the impossible possible.
Thank you so much. And we will end up our podcast on this exciting note. Thank you very, very much for all this amazing conversation, all the amazing suggestions for our podcast listeners. And I wish you all possible success in your work and really making this huge impact on the whole world, on people's lives. So thank you.
Thank you very much, Milena, for having me on today. And I'm really looking forward to seeing how this is going to come out and being contacted by other people that listen to your podcast. So thank you very much for having me on, and talk to you soon.